What if my kidney cancer returns after partial nephrectomy? Imagine having part of your kidney removed to treat cancer and wondering what happens if the cancer comes back. It's a common concern, but knowing the facts can help you feel more prepared. When kidney cancer returns after a partial nephrectomy, it means that some cancer cells were left behind or have developed anew. This can happen in the remaining part of the same kidney, in nearby tissues, or even in the other kidney. Sometimes, cancer can also appear at the site where the surgical instruments entered the body during minimally invasive procedures, but this is quite rare. Most recurrences happen within the first few years after surgery, but there are cases where cancer can return even after a decade, which is why long-term follow-up is so important. The good news is that recurrence after removing a small kidney tumor with partial nephrectomy is relatively uncommon. Studies show that the chance of cancer returning is around 2 to 3% over several years. The pattern of recurrence varies. Some patients may have cancer come back in the same kidney, others might develop a new tumor in the opposite kidney, and some may experience recurrence in nearby tissues or at the surgical entry points. The likelihood of recurrence depends on factors like the original tumor's size, how aggressive it was, and how completely the tumor was removed. Your doctor will consider all these factors when planning your follow-up care. After surgery, your healthcare team will schedule regular checkups to monitor for any signs of recurrence. These usually include imaging tests such as ultrasounds or CT scans, blood tests, and physical exams. The goal is to catch any return of cancer early, when treatment is most effective. Even if you feel perfectly fine, ongoing surveillance is crucial because kidney cancer can sometimes recur without obvious symptoms. The timing and frequency of these tests depend on your individual risk factors, but staying vigilant is key to catching any issues early. If a recurrence is detected, several treatment options are available. The approach depends on where the cancer has come back and how extensive it is. In some cases, a second partial nephrectomy might be possible if the recurrence is limited and your remaining kidney function is good. If the recurrence is more widespread or involves the entire kidney, your doctor might recommend removing the whole kidney through a radical nephrectomy. For small, localized tumors, less invasive options like cryoablation or radiofrequency ablation can destroy cancer cells without major surgery. If the cancer has spread beyond the kidney, systemic treatments such as targeted therapies or immunotherapies may be suggested. Sometimes, participating in clinical trials can give access to new treatments under careful supervision. Your healthcare team will help you weigh the benefits and risks of each option to find the best plan for your situation. Protecting your kidney health remains a priority, especially if you have only one kidney or reduced kidney function. Treatments are chosen not just to control the cancer but also to preserve as much kidney function as possible. This approach helps maintain your overall health and quality of life. Remember, every case is unique. Your risk of recurrence, the surveillance plan, and the treatment options will all be tailored to your specific circumstances. Regular communication with your medical team ensures you get personalized care and the latest information. In summary, while the possibility of kidney cancer returning after partial nephrectomy can be concerning, advances in surgery, imaging, and treatments mean many people manage recurrence successfully. Staying vigilant with follow-up appointments, understanding your options, and working closely with your healthcare providers are the best steps you can take. Always seek personalized advice from your medical team, and remember that early detection and appropriate treatment can make a significant difference in outcomes. Your kidney health and overall well-being are worth the ongoing effort.